Hello, Dr. Danaevs here from Steinway Family Dental Center. We get a lot of questions about laser dentistry. So today we're going to answer some of the most common questions that we get on that subject. And hopefully we can shed some light on it. The first question we have is, what is laser dentistry? Laser dentistry is dentistry that's done by laser. Very simple, right? In reality, the laser device is basically a light beam that can be used in dentistry, and with that light beam you can either cut tissue or reshape tissue, right? Well, the next question is, how does laser dentistry work? So the laser beam is the beam of light that is concentrated, and in concentration of it, it is penetrating a tissue. Some lasers work because they're penetrating water in the tissue, some just cut the tissue, and the beauty of the laser is that it is painless. So you don't need injection when you're getting a laser treatment, and that is the most beautiful thing about it. The next question is, laser dentistry safe? Laser dentistry could be very safe. Some of the procedures, like for example, you can cut with the laser, so you do have to have precautions. Like for example, it's a light beam, so you need specific glasses to make it safe for the operator to operate it, for the dentist or the doctor to cut it, and everybody in the room is supposed to wear safety glasses, right? Because you don't want to shine that beam into somebody's eyes, right? Because that would be damaging. But if you're wearing the safety glasses during the procedure, then it is very safe. The next question is, what are the benefits of laser dentistry? The benefits are that you can do, let's say, fillings, or you can cut tissue, whether it is soft tissue or hard tissue, like you can cut teeth or you can cut gum, and you can reshape gum, and you don't need injection for that. So it is painless, it is quick, and as the laser cut, it also coagulates, so a lot of times the sutures are necessary. So it is much easier to tolerate procedures with that. Like for example, if you're getting a filling, you have a cavity, the cavity could be cleaned with the laser, and then you would put the filling in it, and you don't need injection, and therefore after you're done with the filling, you can use the filling right away. So that's the beauty of the laser treatment. The next question is, what procedures could be done with laser dentistry? I think I just answered that. You can do fillings, for example, with the laser dentistry, and you can also do gum treatments, right? You can remove calculus from underneath the gum. You can do snoring techniques that you can shrink the palate of a patient so the patient doesn't snore anymore, or reduce the amount of snoring and how loud they're snoring with the laser. So you can reshape different tissues with that. There are some cosmetic things that could be done with it. Some laser, if it's done on the skin, it could also remove acne and so on, or reduce acne formation, because they would affect the layer underneath the skin that produces acne. So you can do ablation with it. Like for example, the skin could be burned on the surface, or it could be heated inside. Like for example, some people have different pains and aches, and the laser can go inside and heat up the tissue and remove the inflammation of the tissue with that, and the pain will stop almost right away. The next question we have is, how much does laser dentistry cost? Well, of course it depends on the procedure, but laser is just a tool to do the procedure, right? So the price would be varied. If you're interested to know how much would your particular procedure cost, then you can give us a call. We will evaluate you, and we'll let you know before we start the procedure how much would it be for your particular procedure. Next question is laser dentistry covered by insurance? The answer is, insurance does not cover using of any tools. They cover procedures, right? So it doesn't matter whether you use laser or not laser, the insurance company will pay for the procedure that you are getting done. So whether you use laser or you're not using laser, the procedure is what's covered, not the tool that you use to do the procedure. So the answer is no, they would not cover laser per se, but they would cover the procedure that you would get done with that laser. The next question is, what are the risks and side effects of laser dentistry? Well, the risks are starting with you not being safe, with you not wearing safety glasses, for example, because it can be damaging to your eyes to look at it. Therefore, hey, you can look at it only if you are wearing safety glasses. If you're wearing your safety glasses, you can look at the procedures down and so on, and it's very safe. The other thing is you have to realize that the laser beam is cutting different than the burr, right? So first of all, you don't need to drill the tooth with the drill bit or with the burr, right? You can do that with the laser. You can clean the decay with the laser, and you don't need to have a drill to be used in that. I think a lot of people liken it that there is no drill usage. Interesting. That's the next most common question. Can laser dentistry replace drilling of the teeth? The answer is, for the most part, yes. It can replace for a lot of procedures. In some particular cases, that drilling is still necessary, but there are a lot of procedures that could be done without the drills because we can use laser for that. The next question is how effective laser dentistry for gum disease? And I would say it's very effective. In fact, I think it is more effective than using hands instruments alone, right? Because the laser actually hits the tissue and it's almost like sterilizing the tissue with that, right? It's like having your own autoclave sterilizing the instruments. Now they're sterilizing the teeth inside, but it doesn't mean we're cooking it, right? Because the laser will hit the area that's full of bacteria. It's called pocket, right? It's the space between the gum and the tooth. So they would remove the tartar inside that becomes very hard and attached to the tooth, and it also will kill bacteria building it. So that's the beauty of laser treatment. The next question is, laser dentistry suitable for children? And the answer is yes, it is. It's actually very good for children because, again, most children get upset that you would give them injection if you have to do a filling and so on. But you don't need to give them injection because with a laser you can do it without injection. As long as the children can stay still for a little bit, and I'm sure your dentist is skilled in that, and if not, you can bring the child here and I will help you with this. Most kids are very appreciative and they do understand that they're interested that this laser beam can actually fix their tooth. And it is painless, so that is an amazing, amazing tool. The next question is, how long does laser procedure take, right? It depends on the procedure itself, but let's say a filling could be 3 to 5 minutes and you can have the decay cleaned out and the filling placed and cured, and everything is adjusted and done. So between start to finish, it's actually very fast because you're not wasting time waiting for the anesthetic to take, right? You remember your dentist gives you injection and then you're sitting and waiting for you to get numb before he starts. So that's just like 10-15 minutes wasted. With this, you can start right away and you finish and you can use it right away. So 3 to 5 minutes. The next question is, how do I find the laser dentist near me, right? Or near you, wherever you are. Now, if you're somewhere close to us, you can just call us for that. There's different, you can Google it as laser dentistry near me and see if somebody will come up. But it is a very tight community of dentists that have particular laser that can do everything. Most dentists can have specific small lasers, but it is the laser procedure itself. The laser themselves is so expensive that not a lot of dentists will go and spend the money, especially because we don't get paid a lot more because we use the laser on that. Well, I hope I have been able to answer some of your questions, because those are the questions that we get for us, or the most common questions that we get. And if you didn't hear your question answered, you can call us and schedule an appointment with me at 718-728-3314, or go on alldentalneeds.com and request an appointment, and we can talk about your particular problem.